Hi guys, it's Dr. Bell with Lake Country Pediatrics. In honor of National Child Safety Week, I wanted to share some tips about poison prevention to ensure that your children stay safe in their home. The first is to store medications and cleaning products out of reach and preferably locked up. Some medication packaging may be advertised as being child-proof, but it actually just slows children down from being able to access the product that's inside the packaging. So important to just keep those out of reach, locked up also if needed, so that your children stay safe and don't accidentally ingest something that they shouldn't. The second is being aware of what types of plants you have in your home and around your home. There are several plants that are common household plants that could be poisonous or toxic to your child if they were ingested. There are many online resources that have lists of common household plants as well as pictures, so you can possibly identify what types of plants you have and then decide if that's something that you still want to keep in your house, or at least be aware of as being a risk to your child if something gets ingested that would warrant a phone call to the Poison Control Center. The third tip is to keep products in their original containers so that you know what the product is, and that if there's any extra safety features on that product, on that packaging, that is still intact for that product to keep your child safe. The next tip is to be mindful of purses or bags that maybe a family member or a friend might bring over when you're having company. Lots of people keep medications in their purses and bags and may not realize that that's something that your child could get into. The same goes for visiting other people's houses. Not everybody's house is going to be child-proofed, so keeping a closer eye on your child when visiting other people can help reduce any possible accident or ingestion. The next tip is being aware that there is a center called the Poison Control Center, and it is a free service that is available to everybody. Their phone number is 1-800-222-1222. They're available 24/7. They're available for questions if you're not sure that your child ingested something, but you're concerned they may have. They can let you know if there's symptoms that you should be monitoring for, if that's something that they should be monitored for in a healthcare organization. And they're just a great resource. So keep that phone number available, save it in your phone, put it up on the refrigerator, and know that that's an option if you're not sure, or if you do know that your child ingested something, so that you know what the next step should be to keep your child safe. And then lastly, knowing that babies, when they're crawling, or toddlers when they're crawling around, it is not uncommon for them to explore their world by putting things in their mouth. So it can be helpful as a parent to get down on their level and just see what they can reach and what is in their eyesight, to help identify other possible hazards that you could have in your home. You might be surprised what you can find. As always, we're here to help answer any questions that you guys might have about accident prevention at home. Please reach out if you have any questions or concerns. We're hoping that together we can help prevent accidents before they happen. And happy National Child Safety Week.